Here we are, more than 21 months into COVID-19. 21 months in which we've gone from isolation as the only defense that we seem to know about against dying from COVID to more than 90% of the population of British Columbia being vaccinated. The psychological impact on people has been astounding. In late spring 2020 through to the delivery of the first round of vaccinations, it was as though we were collectively holding our breath. Now, with the vast majority of adults in BC having received 2 doses, there is a sense of calm that seems to be returning to the streets. It's as though we've taken a collective sigh of relief. People aren't looking at one another as if we could kill each other simply by breathing any longer. Already, the province is delivering a 3rd or booster shot, and come the new year, pharmacists in BC will become your go-to location to get the jab. Dr. Penny Ballem, the executive lead of the BC immunization rollout team, says the delivery of vaccinations in BC has been very successful. Well, that may be an understatement, a very modest understatement, when you consider the BC rolled out vaccinations differently. The province's mass injection sites not only sped up delivery, they also provided employment for many people who had lost their jobs and provided needed revenue or income to venues that sat empty. I invited Dr. Penny Ballem to join me for a conversation that matters about how we got to now and where we go to from here. Dr. Ballem, welcome.
Thank you so much, Stuart. It's a real pleasure to be here.
And congratulations on what, in hindsight, we look at now and say, what a fantastic rollout. It wasn't so easy though, was it?
No.
Take us inside some of those early days. How did you start to make the decisions that say, this is the way that we can deliver the greatest amount of vaccination to people throughout the province and structure it in a way that we got to the most vulnerable first?
Right. Well, thanks so much. And, looking back, it seems such a long time ago. I think, one of the first things that was so important for us and has continued every day throughout is to have the leadership, the public health leadership from Dr. Henry and the minister and all the chief medical health officers around our province. Like I always said to them, I'm just the truck driver. I'm delivering the goods. You folks need to give us the guidance, the direction, and set the priorities, and it's our job to figure out how to get that done. So that was really important. I think the other thing is I was so fortunate from my days at the city to have worked with a group of people when we put on the Olympics that actually are used to working in very constrained timeframes, very, very hard deadlines, a lot of uncertainty. You have to be nimble and flexible. And I think the combination of the little team we put together, it's only 7 of us. And That's it. It's a team of 7. And then the partnership with all the health authorities who are, many of whom are old colleagues and friends of mine that I've worked with over the years, and the next generation or 2 of really incredible people that, have come together to actually do something that we've really never done.
Well, never done.
Yeah.
First of all, you had to go out and source the vaccinations.
That's right.
With such a small and highly focused team, how do you get in the queue to ensure that you're going to get the appropriate number of vaccinations that were required?
Well, I think a lot of it's about relationships and understanding, what was important and, who we needed to focus on first. You'll remember the 3 goals of our campaign was manage the pandemic, protect the most vulnerable, and protect our healthcare system. And, sort of deconstructing that made it pretty clear with guidance from public health what we had to do first. So we had to get our healthcare workers vaccinated as a high priority because if they started getting sick, we were going to be hooped. And we saw that in other parts of the world. And then to actually get our most vulnerable, which as we've all learned from Bonnie Henry, were our oldest, and then groups of other people with chronic medical conditions and are very vulnerable, clinically extremely vulnerable groups. And really it was sort of starting to understand, well, who those people are, where are they? I can tell you that, data has been fundamental for us to understand, the age construct of communities all over our province. How many people were over 80 that we were going to have to vaccinate in Pouce Capet?
Right.
All of these details. And then, in the early days, as you mentioned, out until really the end of May, we were every week struggling with, well, how much vaccine were we going to get?
Yeah.
And I think, I do want to put in a plug for our federal government. They did a remarkable job because they procured a lot of vaccine, way more than we need, which means we can contribute to the global effort. But, those early days were tough. And they were spreading out a limited amount of vaccine around the country. So we had to be very, very clear what are our priorities, how do we explain those to the public, how do we get them to their vaccine and get the vaccine to them. And it was a whole new world. And we put one of our venue modelers from the Olympic Games together with the health authorities, and they, in 2 weeks, designed what is the model clinic. How would it work? What would the flow be? How would you manage the queues? How do you make it safe and secure? How do you build in the recovery room? And literally in 2 weeks we had a design, and then we sort of drove it out through the health sector, and they went out and found the venues and put in place this model of flow of people, of staff, of vaccine. And we nuanced that over the last couple of years, but essentially it was a lot of that early work of where were we going to do it, how many people would we expect, how would we manage them, how would we give them a great experience, protect the vaccine, not break the cold chain of the vaccine, and actually flow the public through. And Stuart, I've worked in healthcare a long time. I've never got the ratings that we've had for this program in my whole life. It's remarkable.
As you're explaining all of that, though, my head hurts trying to understand and figure out how do you, identify each one of those elements, figure out the plan amidst like the glaring spotlight of intense scrutiny and criticism, and still have the confidence that you're going to be able to make this happen. There must have been some pretty long and challenging days to get through that.
Yeah.
Still not knowing for sure, is this the right way to go? Because not everybody was following BC's lead.
Well, I think a couple of things. It was very, the first, I would say, 5 months, it was pretty much 24/7. And, just all these details. I think we were very lucky because we had great data. Like we knew every day at the end of the day how many people we'd vaccinated, who they were, how old they were, where they were from. And it's very, very rare to be able to have the privilege and the advantage of running a program where you actually have that kind of feedback loop, like in a 24-hour turnaround. So we used data intensely. We used our relationships. And, when we had a problem, we'd bring someone in that one of us had known through whatever parts of our career. So just old, relationships, networks, colleagues that, you felt comfortable just phoning up and saying, look, we need some help. Would you come in? And so many people have stepped up and helped us. And I think, we saw ourselves, I think the big advantage we had is that we really didn't have a lot of authority as a team. We were enablers. And so I think the health sector, it took them a bit, but they really started to appreciate that we were there to move the barriers out of their way, push the boulders off the road, get decisions made as quickly as possible. And we set up decision-making committees and fora that we are still in today. So, for that first few months, every day, we met with all the CEOs of the health authorities, Bonnie Henry, the Deputy of Health, and, basically my team. And we made decisions. And then once a week, we met with all the health authority senior leads. And now we've added the Pharmacy Association folks to that. And we went through all the problems, so it was a safe place where everyone could say, this isn't working for me, or what do you, can we fix this, or can we fix that? And I think we saw ourselves as fixers. People who had access, very lucky to have access to the minister, to the premier when we needed it, to our deputy on a daily basis, and able to, put things together, bring them up and say, look, we need a decision on this. I think for Stephen Brown is our deputy, and Bonnie Henry, the PHO, like to have their attention and their commitment to help us make it work. We couldn't have done it without that kind of cooperation. Very unusual, you know.
Well, very unusual. And you talked earlier about it. It's about relationships. I had Perry Bellegarde, the past national chief of the Assembly of First Nations, in once, and he said, "If you can't build relationships, you can't build anything."
That's right.
This is so true. Even still, you start moving beyond the most vulnerable to begin with, and then you start opening up these mass clinics. How are you going to get the people that you need in to be able to deliver all of that?
Right.
How important was it that, like, dentists and so many others said, "Okay, I'm in. I'm going to come and I'm going to help." Like, how important was it that this became a collective effort?
Oh, it was. I think you mentioned earlier on, some of our partnerships, right? And so, through Dr. Henry's work and our ability to take things forward to her, she created a whole array of different health providers across the whole continuum, as you said, dentists, physiotherapists, speech pathologists, like anybody who was a regulated health professional was now permitted under her regulation to actually be an immunizer, which had never happened. Firefighters, paramedics, the whole works. And so that was an incredible advantage all around the province to be able to tap, wherever there was some redundancy and people available, retired people, retired nurses, retired doctors, all of these people all wanted to help. And, as you described, a lot of people were off work, really frustrated and wanting to make a contribution. And so whether it was our kind of community partners who helped us run our clinics, the Canucks and the YVR and the sports teams and the airlines, like we had these incredibly well-trained people, the cruise industry, Ceres and Pacific Destinations, all these people who spend their lives managing queues and people and sorting out their problems. They were incredible partners, brought skills that we don't have necessarily in healthcare. And then all of our professionals who wanted to be part of the success of getting our public to a place where they were safe again. And it was like just incredible partnerships and relationships that we couldn't possibly have done it if you just thought this is the health sector that's going to do that. We wouldn't have been successful. So
where are we at right now as we move into our next level of immunizations? We're moving into the realm of children.
Right.
What's ahead of us, and what do parents need to know right now as far as their children being immunized?
Right. Well, we're very excited. Today's a big day because, as you know, the Health Canada and the National Advisory Committee on Immunization, which gives advice to our country around immunization programs, have, first of all, the vaccine that has been brought forward, the Pfizer vaccine, has been now licensed by Health Canada and approved for use in children 5 to 11. And NACI has supported a program to immunize children, which is so wonderful. I think it's really interesting. I learned this because as a physician, I worked for many years in a sub-area of women in pregnancy. And I learned about parents at that time because, I didn't have any grandchildren then, or, I only had one child. But, parents make very different decisions about their children, especially their small children, than they do about themselves, right? They'll take way more risks for themselves, but with their kids, they're very, very thoughtful. And we know from the surveying that we've done that, about half of the parents in this province really want their children vaccinated. And unless they hear something that's extremely worrisome, they're going to want to do that. And then about 20% are thinking, yeah, I think I want to, but I want some more information. And then about 30% are definitely not ready. And so for us, what's going to be really important is to have really basic information that clarifies a lot of the questions people have, and that has a lot of integrity about the evidence and what we've learned and what we know, and that is understandable and, in some cases translated so that, parents with English as a second language can have it in their own language. And actually for their physicians, their primary care physicians and their pediatricians, that we actually provide, really coherent and comprehensive information so that everybody knows what are all the facts and figures and what does that mean. And, I think for me, when you look at a vaccine for children, there's two I see sort of two aspects to it. One is the individual child. Is this safe for a child? And it's a very safe vaccine, very, very effective. And so I think all of us and all of our public health leadership feel very, very comfortable recommending this and saying, you know what, if you want to protect your child, and through that, because we know children don't have, in Canada, we haven't had an experience of a lot of severe illness in small children, but they can get sick, and a small number can get critically ill, but it's a very small number. So, some would say, well, they don't get that sick, what's the problem? But at the end of the day, the second part of all this is, as long as children in that age are a continuing quite large reservoir of that virus moving around, their lives are compromised because their schools get closed, their daycares get closed, they're not allowed to participate in this activity and that activity, they can't do sports, they can't sing in the choir.
Can't see their grandparents.
Can't see their grandparents. And until all of that comes back to normal, in some ways, the two things are equally bad for childhood and for children.
Right.
So that's we have to kind of
right. How are we going to deliver the vaccine to all those children, because they are spread out across the province like everybody else?
That's right.
So what's the plan?
From 8 to 80 is what I always say. So we have to have the same approach of knowing where our kids are, what age they are, what communities, how many. Normally we for kids this age we go to the schools, and but it's a long journey to get around all the schools. Like there are a lot of schools, elementary schools in this province, way more than high schools.
Yes.
And so I think, and we've talked to the parents we did a big survey about, well, what do you think? And I think the very gratifying thing is that they feel very good about their experience that they had. And they've said to us, if you can, provide an environment that is appropriate for our kids and safe, and where they have, if they're having a hard time, they can go and have a private space with their family and our immunizers and our support people, then we want to come to your clinics. And so that's what we're doing.
So as we move into the third round of vaccines, you've now started to work with the BC Pharmacists, the Pharmacy Association of British Columbia, to deliver that, because it's a remarkable network that's in every community. Will children be able to access that service through pharmacies as well? And then let's talk a little bit more about why it's important that you moved for sort of the third wave of vaccination out to the pharmacists around British Columbia.
Sure. So really great question. So for the pharmacists at this point, they're going to be dealing with 2 vaccines, actually 3, because we'll get some more AstraZeneca.
Oh, okay.
So Moderna, Pfizer, AstraZeneca. Moderna, a bit complicated because it's half the dose it was. So our pharmacists are doing dose 1, dose 2, and booster. So that's a lot of jangling, lots of maneuvering. And so the pediatric vaccine is a new one. It's a completely different vaccine, and these are small children. So our initial campaign, which is designed to get as many kids through in the next couple of months and get them all done, we're going to largely do through our clinics. We're busy getting the pharmacists on board to do the booster, and essentially our hope is that we can push more of our adult population to the pharmacists, where they can provide them their booster shot, and then focus a lot of our health authority resources on these special environments for our kids and get them through our clinics. And so we'll have clinics that have you can bring your family. So if you've got a couple of kids in that age range, you'll be able to come together. And if the parent is not vaccinated, which or an older sibling, we'll do them as well. Like we're open to it all, and we want them to take advantage of the Get Vaccinated system and get invited. And in the pharmacies, we want to keep them really busy doing our booster campaign. There's a lot of people. We have 4.3 million people that now are going to need a booster over the coming months. So that's going to keep them very, very busy, and keep us busy. Keeping the vaccine in their inventory. So I think it's going to be a bit of a 2-channel ride here.
So as I go to the pharmacist and I want that booster, and I say, well, I've had 2 doses of the Pfizer, What do I do now? Is the pharmacist also going to be in a position where they can give me that kind of advice as to what is going to be the best approach moving forward? Because there is conflicting information out there.
Well, I can tell you, like, I'm not a public health person, so I just
Right.
want to clarify that.
Yeah.
But I spent a lot of time with Dr. Bonnie Henry. So, I mean, a couple of things. The only booster we have at this time is the mRNA. So it's either Moderna, half dose of Moderna, or the same dose of Pfizer as you got originally. We know that mixing the mRNA vaccines, there's absolutely no problem. It's very, very effective. You know, there's a sense, Moderna is a very powerful vaccine. We've used it in our frail elderly because it has it had, you know, a little teeny advantage apparently, but generally either one is excellent. And in some cases, Stuart, we're you know, just because, like, look at what we're dealing with this week. We may not be able to have both Pfizer and Moderna in every pharmacy while we're sorting out our logistics.
Right, getting in some of those flood-affected areas, getting the vaccine there may be a bit of a challenge.
That's right. So if we can get one vaccine, we're going to be very, very happy. So that and the different supplies. So we will, you know, most of them will, in the end, have, we hope in January, both vaccines. During December, it's going to be a bit tougher with all the constraints we have, but either one is terrific. And if you've had AstraZeneca, we will only be able to offer you mRNA for a booster. That's the only boosters that are licensed, and that's a terrific combination. So AstraZeneca followed up by mRNA is a really great protection from COVID. So, you know, I think generally it's a win-win. I do want to put in a plug. We have AstraZeneca coming again. Because people like it and they want it. Some people who haven't yet got vaccinated. So it will be there for dose 1 and dose 2. And
would you be able to get it at the pharmacy?
You will, yeah.
Oh,
absolutely,
okay.
Yeah.
So,
but that's we haven't got any replacement. We're out right now of AstraZeneca, but we're hoping to get some more. And then the Janssen vaccine arrived at 5,000 doses last week. And
what's the thing that you are the most pleased with in the rollout and delivery of vaccinations in British Columbia?
The outcome, first of all, you talked about it. It's that you can feel the calm.
Yeah.
It's so wonderful because it has been such a run, you know, and a stress for so long. And then I just think I'm so proud of our province, of all of us. Everybody's contributed, local government, you know, elected officials, health people, the industries are all around the province. Like, they've all jumped in. I haven't made a call where anyone hasn't said anything else. Oh, gee, Penny, I'd be happy to help. What can I do? And, you know, it's not, for me, I'm at the end of my career, you don't get a lot of chances to have an experience like that, right? When everyone wants to help and you're doing, like, for me, it was the happy file of COVID. And, you know, it's just, it's really terrific. So that's what I feel proud of. We have a great province and we did a great job.
Well, congratulations on the job well done. Thank you.
Thanks so much, Stuart.
Yeah.